Hello, my name is Levi Brown, and I will be discussing the pandemic that we are currently facing, COVID-19. On March 11th of 2020, the World Health Organization declared COVID-19 as a worldwide pandemic. Since then, this virus has brought about nearly 3.43 million cases and roughly 138,000 deaths in the United States alone. We've seen our way of life change before our eyes, and this has brought about many conflicts and many lost opportunities. Athletes have missed out on entire seasons. Every public event that you could think of was canceled, and we've been asked to do nothing but just stay at home. Now, the question that everyone's asking is this all necessary, or do we not yet know enough about the side effects of this virus and how lethal it is? I will help answer some of these questions by explaining the severity of this virus, the effects it will have on our society, and the effects it will have on our future. Our generation has never been exposed to a pandemic before, so the effects of COVID-19 will last a lifetime. Have you ever had the flu or some sort of seasonal sickness? Maybe it runs in the family, or maybe you contract it from each other. Because in an article released by WebMD on July 15th of 2020 states that the most common way to catch this virus is from person to person as opposed from surface to person. When humans cough, sneeze, or even talk, we release tiny particles called aerosols, which float through the air and carry the virus. And researchers show that this virus can live in the air for up to 3 hours. Though it is not as common to catch the virus from touching a surface, you can contract it from touching, say, a doorknob, for example, that someone else who has the disease touched recently. So how do you know if you have this virus if you haven't been tested yet? Well, it affects different people in different ways. The most popular side effects are coughing, shortness of breath, fever, chills, headache, and a sore throat. While these side effects could very well mean that you have the virus, there are people who are asymptomatic, which means that they don't show any of those symptoms, but in fact they do have the virus. This makes it nearly impossible to know who has it and who doesn't without getting tested. According to BBC News, in an article that they released on March 24th of 2020, the mortality rate of COVID-19 is anywhere between 0.5% and 1%. Though this number seems really low, COVID-19 can cause permanent damage to your respiratory system, and it's because of these long-term effects that we as a community need to play our part in stopping the spread of this disease. While contracting the virus and getting sick is one problem, it has led to many social and economic issues as well. According to the Center for Infectious Disease Research and Policy at the University of Minnesota in an article that they released on May of 2020, the country has lost nearly 20.6 million jobs since mid-March, which results in an unemployment rate of 14.7%. We have not seen this level of unemployment since the Great Depression in the 1930s. The government was forced to shut down, which resulted in countless businesses to close and people to be put out of work. Schools were shut down and had to be switched to online learning. Collegiate and professional sports leagues had to shut down their seasons completely, some of them even within the middle of games. While we have made some strides as a community to slowly reopen certain things and get money back in people's pockets, things will not go back to normal until a vaccine is released. Unfortunately, these social barriers and restrictions will most likely spill over into 2021. Conversely, we do not know what the future will bring us. We all assume that society and the normal way of life that we're all used to will be different for the near future. But this virus will have effects that could last a lifetime. For example, the emphasis that we put on personal hygiene and cleanliness will remain in full effect to prevent the spread of any germs or any common cold. Public transportation and traveling could come with extra precautions and measures. Whatever the case may be, we cannot be certain of what the future holds. With fluctuating numbers of cases in certain areas, it's hard to know what to make available to the public. Until a vaccine is released, we cannot possibly know when schools will open, when sporting events can take place, when concerts or gatherings or any public events can take place. Though the near future is surrounded by question marks and uncertainty, the people of this nation and of this universe are still hopeful for a better tomorrow. So now that we've discussed the severity, the effects on our society, and what the future could hold, where do we go from here? How can we make things better and safer for our society? There are many things that you can do, and you should start by keeping yourself clean and frequently washing your hands. If you have to cough or sneeze, do so in the crease of your elbow. If you're going out in public, be sure to wear a face mask to limit the amount of aerosols that we release into the air. While all of this is inconvenient for many reasons, it is still up to the people to play their part in help stopping the spread. Your personal agenda needs to be put to the side for others' sake. Even if you feel fine or you aren't scared of this disease harming you, you could still pass it on to someone who could be harmed by it. And even if you luckily make it through this pandemic without many big changes in your life, the madness that came with this outbreak will be remembered forever. So with all of that being said, will you join in the battle to stop the spread of COVID-19?